Hello, my name is Dr. Roshni N. Patel, and I'm the Medical Director here at the Center of Excellence in Pain and Regenerative Medicine. Today, we're going to be talking about plasma-rich protein, PRP therapy. PRP therapy is platelet-rich plasma protein, which is derived from your own blood. The way we obtain your blood is a simple blood draw that you would do at a laboratory. We take out one test tube worth of blood, we put it into a centrifuge, and that centrifuge separates out your different layers, from red blood cells to white blood cells to the plasma. The plasma is derived from your platelets. The platelets have the platelet-rich protein, which is made up of cytokines and growth factors. Those cytokines and growth factors, once injected back in under image guidance, will help repair those tissues permanently. So this is what it looks like after it's separated out. This is plasma-rich protein, PRP, which is the golden serum. This is worth its weight in gold, because when we inject this back in, it's going to start the magic. It's going to start healing your pain. It's going to start healing your tears. These injections, because it is your own blood products, need to be in a sterile environment. You do not want to contaminate that blood. You don't want that blood mixing with anything else. You should be the only patient where that blood mixture is being prepared. This room is my procedure room. This is where we have the fluoroscopy as well as the ultrasound guidance to do these injections. It's a completely sterile room with the filtration rate, as well as everything will be done under aseptic protocol. It is very important to have image guidance because the closer your PRP to the injury site, the better your outcomes. That is actually one of the key reasons of why we have success rates of these procedures, because it must be done under ultrasound or fluoroscopy guidance. This is a live fluoroscopic image. What we start with doing is first taking some pre-images, and all the injections will be done under live x-ray guidance. So this is an example of a knee. This is where your menisci are located. This is where your ACL is located. So if you're just doing a blind injection, studies have shown that 60% of the time you miss the spot. Under image guidance, the closer you get to the problem, the better your results. So what we do is use this image. If this is the patient laying on the table, we line up those images, match it up to what's on the screen. What you want to do is get as close as possible. For example, if this is a meniscus injury, you want to inject very close to that menisci, and you can see that it's a very small area. The closer this PRP is to this area, the better your results will be. You also have to use image guidance so that it's one and done. You don't want to be poking around and hurting the patient. So you inject here, match it up to the screen, make sure that it's a good position, and then you're just injecting a mil into that area. It's a very fast procedure. From the minute we draw your blood till we inject, takes 45 minutes. The blood draw itself takes about 10 minutes to do. It spins in the machine for about 30 minutes. Once I prepare your PRP, which takes another couple of minutes, it takes me literally a minute to inject once done under imaging. And that's one of the other benefits. Because of imaging, I know where I'm going, and it's done very quickly. The procedure most of the time is painless. If there is any discomfort, it may last for a day to 3 days, which Tylenol takes care of. Never is any pain medications needed. The healing process starts immediately. Once this is injected in, within seconds, your body gets the signal that it needs to start healing itself. The benefits will be seen from 3 months onward. Many of times, patients do start feeling better immediately, a couple of weeks into the procedure. However, the real regenerative process benefits will be seen at 3 months onwards, because the first month is about inflammation. The PRP sends in a calling card saying that I need to heal itself. The second month is about building new blood vessels into the area. So those new blood vessels will bring in the nutrients that the body needs to help rebuild their cells. The third month onward is when you start laying down new collagen, new elastin, new fiber, and that helps strengthen the joint. That's typically when the patient starts noticing improvements in mobility, improvements in their pain levels, and improvements in their strength. That, in coordination with physical therapy, helps with those outcomes. Oftentimes, patients just need that one injection. They're one and done. It helps repair their tissues. They gain back their activities of daily life, and that's it. PRP is a wonderful option if you're looking for an alternative to surgery, if you're looking for an alternative to steroid injections, and you're looking for an alternative to medications. You may have tried medications that did not work. You may have tried steroid injections and they did not work. And you may have been given the option of surgery, but you're looking for an alternative. Then PRP is absolutely that option.
The Supreme Center of Excellence in Pain and Regenerative Medicine